2 years ago, I had what they call a widowmaker caused by a condition called SCAD. Yeah, one night I was just sitting here watching television with my family and just didn't feel good. And I hadn't felt well all day. I had some mild chest pain and some jaw pain, and my watch indicated that my heart rate was high. At some point, just felt like this impending sense of doom, which I know you hear about, but it's a real feeling. I ended up asking my husband to call 911.
So she was having a heart attack. And similar to any heart attack, if you don't go to the emergency room when you first develop symptoms, if you delay seeking care, that's going to put you at risk, most importantly, for death.
It didn't make sense. Like, when I think of myself, I eat healthy, I work out all the time, so I wouldn't have considered myself at risk for anything cardiac.
With Michelle, we saw a progression of her symptoms. She started with non-traditional symptoms of just a general feeling that something was not right, which she dismissed as non-cardiac because she had never had a cardiac symptom, and there's no reason why she would have been thinking that that was the issue.
For instance, I would go for a walk and I would find myself like rubbing the center of my chest and thinking that I was either a little bit out of breath, like I worked out too hard, or I was a little bit out of shape, or that it was heartburn, because it wouldn't register to me as pain. And I had jaw pain, which I would not have known was related.
Her symptoms progressed, and she did develop classic symptoms. And that suggested from a physiologic standpoint that her condition was worsening.
SCAD is a spontaneous coronary artery dissection where part of my artery tore. So the fix was Dr. Burt was kind enough to put 2 stents in, which doesn't necessarily repair the artery, but it clears the blockage. So he was able to restore blood flow, which was amazing. But then it takes about 3 months to actually heal the tear. From the moment I saw the sun rise after my surgery, from that moment, I just thought, I'm just gonna live this differently, in the sense that I will take what I know and what I have and continue to grow and move forward and try and have as many meaningful experiences in my life as I can and not take them for granted. Cardiac rehab was just a great place to get started. I was really fortunate that the Miriam has a great cardiac rehab facility. It's not a one-size-fits-all approach. You know, my family is a huge support system. My parents, my children, my husband, I don't know. We've been on this journey together, and it's just amazing that I can continue to do it. I can't say enough about my cardiac team. They, from the get-go, the fact that they even suspected that was what was going on is literally what saved me.
I think Michelle is a great example of how this system is working well, and how having expertise in a certain area can really help change outcomes. To have a team around her that can provide her with the most up-to-date, the most novel therapy, and the best guidance to get her the best outcomes going forward is going to help extend her life, help her live a happier life, and do better in the long run.
I'm so happy to be here, to be able to share my story and, you know, maybe just make a difference. And, you know, you can't take the teacher out of who I am. It's part of what I do. So to just continue to educate people, maybe it's not the same as teaching my first graders, but there's so many people that could benefit from just hearing my story. I want to take advantage of every opportunity. I really, truly believe that Miriam gave me a second chance.